for today is overactive bladder, what we call the symptom complex, where women suffer from increased frequency of urination, urgency, and they leak whenever they feel the urge to go to the washroom, repetitive visits to the washroom during the night time, excess urination during the night time, and sometimes even unfortunate episodes of bedwetting. Any woman from any age group can be affected with this particular symptom complex. However, it is commonly observed in women above the age of 30 and worsens beyond the age of menopause. Elderly women also suffer significantly with this problem of increased frequency, urgency, and urge-associated leak, but probably due to different kind of disease spectrum which affect the bladder innervation and thereby the storage capacity of the bladder. So let us see what exactly causes this particular problem. Now, the bladder, as you can all remember or would have known, is a kind of an elastic balloon which expands whenever to accommodate the amount of urine which gets stored in the bladder. Bladder is basically a storage organ, and whenever there is an appropriate signal from the brain and the place and the time and the space is appropriate, it voids and relieves itself of its content by contracting. This contraction is in phase with the sphincter action, and the sphincter relaxes at the same time. But when the bladder contracts of its own accord, or the bladder contraction is much more stronger than what it is needed, or contracts inappropriately, this sends the signal of a feel of sudden urge to empty the bladder, and with that urge is associated leakage which happens, which is very, very embarrassing, as this particular leakage can be quite a substantial amount, and that can cause complete wetting of the garments even before the woman reaches the washroom. So the woman learns the habit of frequently visiting the washroom without helping the bladder to become full, to avoid such an embarrassing leakage. So that is the reason for increased frequency. And they also learn the habit of restricting their water intake so that the bladder doesn't fill up quickly enough. And because of these habits, the bladder also contracts much more during the night, and there is an increased frequency during the night. The normal frequency during the daytime is about 5 to 7, and during the night time, beyond the age of 70, is not more than 2 times awakening to empty the bladder. So these women suffer from frequent visits to the washroom more than about 10 to 12 times during the day and more than 3 to 4 times during the night, which significantly disturbs the sleep pattern, and they feel drained and drowsy even during the daytime. So how do we prevent it? How do we control it? Most important are certain lifestyle modifications which go a long way in the prevention of overactive bladder. First of all, women should not be controlling their urge to urinate and postpone the voiding for longer time, say 6 to 8 hours. Timed voiding every 2 to 3 hours is a very good measure to avoid over distension of the bladder and preventing future overactive bladder conditions. At the same time, trying and losing weight if they are overweight is very, very important. Also, adjusting the blood pressure medications at appropriate timings goes a long way in helping the elderly with this particular problem. Apart from that, avoiding caffeine containing drinks such as coffee, tea, aerated soft drinks prevent overactive bladder by reducing the contractility of the bladder, or prevents irritability of the bladder, and such symptoms can be significantly reduced. Do not restrict the water intake if you suffer from this problem, as this can precipitate urinary tract infections. However, do not overhydrate as well. So an optimum level of 2 to 2.5 liters per day is paramount. Most importantly, avoid drinking excess fluids beyond 8 p.m. so that it avoids frequent visits to the washroom in the night and thereby prevents any sleep disturbances. Avoid sugary fluids intake because this can also increase the frequency of urination. So such simple life measures go a long way in reducing the amount of frequency as well as urgency and urge associated leak with this particular condition. So how do we treat a woman with overactive bladder? Most of them, if they fail the conservative measures, we can put them on medications which are of two classes. One of them, which is an anti-muscarinic agent, not only reduces the contractility of the bladder, but also has its effects on the other aspects of the body functions, the common side effect being dry mouth and constipation. This particular side effect can prevent women from continuing the medication, as this can worsen the overactive bladder. Now we have a new medication which affects only the storage capacity of the bladder and has got nothing to do with the contractility of the bladder. This improves the compliance of the bladder, so women are able to hold better and able to void at appropriate time and space. This does away with the side effect of dry mouth and constipation, so women are happier to continue on the medication for a longer time to reap the benefit of this particular therapeutic step. So with the advent of these medications, we are able to give a longer symptom-free period for these women without increasing the intensity of the adverse effects. However, elderly women and certain women will fail this particular medical treatment, and it's not all a door closed for them as far as hope is concerned. We can now inject what we call botulinum toxin, which acts on the nerve endings inside the bladder muscle, thereby preventing abnormal contractions of the bladder muscle, relaxes the bladder better, and helps the women hold urine better and avoids urgency and urge leak. This is done as a day case procedure, as an endoscopic injection of this particular medication into the bladder muscles, and the patient can be discharged the same day. So with the advent of these procedures, we are able to give significant symptom relief and prevent women from the social embarrassment which they face because of this overactive bladder. Thank you.